Dr. PT Christine Paton is on now. To participate, call 1-800-375-2872 or email askme@drptpodcast.com. This is Dr. PT Christine Paton.
Welcome back to the Dr. PT podcast. I'm your host, Dr. Christine Paton, an orthopedic and pelvic health physical therapist. This show is for you to be able to call in and ask your questions about those common aches and pains that show up in your body. But what's not so common is knowing what should you do about it. How do you solve those problems when you aren't sure how to be able to get back to moving in the ways that you enjoy most so that you can do all of the things that you enjoy doing on a daily basis. So our phone lines are open here, and my team is waiting patiently to accept those calls so they can help push them through here so I can answer your questions directly. Our phone number is 1-800-375-2872. And you can also, if you're here on the live stream, throw your questions into the comment section down below, and my team will also help to get those questions to me so I can answer them live here. And then, of course, you can always send me an email during the show or after hours at askme@drptpodcast.com. So for today's episode, I'm going to be teaching on a topic that affects approximately 80% of adults, according to the research, and that is low back pain. So if you have had a low back pain issue or you are currently working through one, I think this episode is going to be really supportive for you. And if you haven't experienced low back pain before, that's awesome. And also the statistics are pretty high that you might at some point. So this information is still going to be helpful for you to be able to learn to help you all continue to move well so you can move often. Now, low back pain, as I mentioned, it affects approximately 80% of adults. And the research shows that the majority of those cases are what we would call mechanical low back pain. And that is a phrase that we use in the medical world to basically say that that low back pain came on because of how you are moving throughout your day-to-day activities. So not a big traumatic event, not a big car accident, not something that directly, created an injury right at the back, but something that just sort of gradually comes on over time, sort of sneaks up on you, and you hope that it's going to kind of go away. And then you rest a little bit, maybe you ice it, maybe use a heating pad. You start to kind of pull back from some of those activities that kind of feel a little bit aggravating, and you hope that it'll eventually just go away. And sometimes it does, but it often kind of then continues to linger and reoccurs periodically. And maybe you start to change your behavior. If any of this is sounding familiar, this is what we would call kind of that general mechanical low back pain situation, right? Now, why is this so common? So I have three main reasons why this ends up being a pretty common issue. So the first is what I call an activity mismatch, meaning that we are doing more than our body has the capacity for, right? This might be that you're doing a little bit too much lifting or whatnot in your day-to-day, or you're ramping up a workout in the gym before your body has time to build up to that capacity. It might be because you were recovering from a previous injury, and usually when we do that, we lose some strength. And then, maybe we start to get back into the things and we realize that, hey, actually, my back pain is coming back, because we often lose strength when we get injured, and we have to gradually build that back in order to fully restore our movement and our overall strength. If that doesn't happen, then each time you get injured, we're kind of starting at a weaker starting point, and before you know it, your overall body capacity has drastically decreased, all right? So does our body have enough strength to do the volume of the activities that we need to do? So there's that activity mismatch. The second reason why this ends up being really common is also what I call a movement mismatch. So in the case of low back pain, yes, we want to make sure that our spine can move well, but it also works on a larger team, right? So your low back also works with your hip. It also works with your foot and ankle, because all of the parts of your leg down below are helping to support the spine up above. So if your hip isn't moving well, if your foot and ankle isn't really moving well, then that's also going to ask the back to have to move more and do more without the rest of its teammates. So this is where I go movement mismatch. All right. Do we have enough good movement at all of the important teammates that are helping to support the back? And then, of course, do we have enough strength in these areas? If not, then your back is going to have to overwork for everybody. and eventually it will let you know. And then thirdly, I have what I call mindset mismatch. Now, with mindset mismatch, a lot of times when people start to feel low back pain or experience it, they will often usually very quickly start to kind of rest, pull back from the activity that is bothering their low back. And that's all understandable for the very short term. Protecting our back in the short term makes sense. But oftentimes what I find with many of my patients is that short-term strategy of rest and don't do the activity that brought on my back pain starts to become the forever long-term plan. And so we then start to lose strength. We start to lose capacity of our body, and especially around the spine and our legs. And then that actually doesn't end up solving the back pain. It actually makes us more vulnerable because we're weaker, and typically will increase people's back pain or start to add pain down the chain. Right? So to recap, we have 3 reasons why low back pain is so common. Number 1, we have an activity mismatch. Number 2, we have a movement mismatch, meaning your joints and your muscles. And then number 3, we have a mindset mismatch. And usually there's kind of a little bit of a combination of those 3. All right. So I'm going to continue this discussion in the second segment where we talk about what are the common myths that get in the way of people overcoming their low back pain next. But I'm going to pause here and we're going to take a call and speak to Pamela here. So 1 second while we get Pamela here on the line. Hi, Pamela. Welcome to the show.
Thank you. I'm glad you're on.
I am too. I'm glad that you called in. What's your question today?
I am 78 and I have mild scoliosis, and I live in rather remote area of South Carolina. Mm-hmm. So if I have to do anything in the car, it's an hour drive, guaranteed.
Yeah.
So number 1, I'm wondering, should I always have my heat on? Does that help or does that irritate it? And number 2, are there some things that you can suggest? I have a replacement of a knee, hip, and shoulder all on the left side. Oh. So, and my scoliosis is off to the right. Mm-hmm. So I'm just wondering, taking that into consideration.
Yeah.
What kinds of things can I do so I can live to be 100?
I love that. Pamela, so a couple things that come to mind. Number 1, if using your seat warmer, I think that's what you were mentioning, kind of in terms of heat, is helpful for you while you're driving, yes, that can be a helpful kind of temporary support just to kind of keep blood flow and sort of to decrease some of the muscular tension that often comes when we're just in a stationary static position for that length of time. The other piece that I'm often kind of going over with patients for long drives is a couple of things. 1, do you have a seat in your car that you can kind of adjust easily? And if so, can you kind of change that sort of seat in your car to be less of a bucket seat and more of kind of a regular sort of like 90-ish degree angle, or possibly even lift the hips a little bit higher than your knees, depending on what type of car you have? What are your options there in terms of adjusting the seat?
Yes, I have a Ford, and there's lots of adjustments.
Yeah. So often being able to bring the hips and the knees at least to level, or if you can possibly bring the hips a little bit higher than your knees, that's going to help to kind of decompress the hips and the low back area, especially for those longer drives. Yep. So that would be one thing. And then if anyone else is listening and they're like, shoot, I wish I could do that, you can also kind of take like a towel roll or different things and kind of stick it right in where the seat and the back meet to kind of fill in that bucket. Or and sometimes my patients still even play with kind of a towel roll or whatnot to kind of be able to help with some of those same things. And then Pamela, the other piece, kind of thinking of the curvature of your spine, the other piece, and this would take a little bit of creativity, but with scoliosis and thinking about your curve, thinking about, is there sort of a pillow that you can place on the opposite side to kind of help balance out that curve while you're leaning back into your seat to kind of give a little bit of postural support, and then adjusting your mirrors to kind of encourage you to be in that position, because often as we drive for longer, we all start to kind of get a little bit more hunched over. And so our mirrors, if they're a little bit elevated at that nice height to encourage elongation of our spine, then they're a nice reminder when we're going to look at our mirror of, oh, am I starting to hunch or did I stay tall? So I don't know if that's possible in your car or whatnot, but those are other things I'm often going over with patients to help with positioning in those ways.
Excellent. Thank you very much.
You're so welcome. Thanks for calling. Have a good one. All right. Next, we have Taryn. We'll bring Taryn here on the line.
Hi.
Hi, Taryn. Thanks so much for joining us. What's your question today?
Hi. I have been suffering from lower back for many years. I've been getting injections, and nothing has happened. Last July, I ended up getting shingles in the back of my leg, kind of hit my sciatica and went down. And so since then, my foot has been a real thick and tingly kind of feeling. It's just feeling weird. It's not numb, but it's real thick feeling.
Yeah.
And so I'm trying to figure out, is it just a degeneration? I know I have problems with S1, L5, or is it something to do with my hips? I have several health issues, so it's hard for me to pin down what problems I have related to, like, is it from my back? Is it from my autoimmune diseases I have? Is it from something else?
You're asking great questions. So first and foremost, like you said, a history with kind of an injury at L5, S1, that particular nerve of the spine does travel down the leg and can recreate and create symptoms like sciatica, so kind of pain down the back of the leg, as well as to the foot and the ankle. So if we haven't had kind of, updated imaging in a while or whatnot, it could be helpful to get some diagnostics on that with your doctor. Since you said that pain injections and things haven't helped in the past, this is something too that low back pain, even if we do have something going on at the spine, I still say, hey, we need to be looking at the hip and we need to be looking at the foot and the ankle. Oftentimes, if we have difficulty... Oh, go ahead.
I have arthritis in my ankles. I know that because I have some arthritis in my foot that I've been dealing with orthopedic surgeon on. And so in my latest MRI, I do have arthritis in my ankles and my feet.
Yeah.
Or at least the one foot anyway.
Yeah. And is that on your right or your left side?
It's on my right side. The left side is where the numb and tingling is. So those feet actually have some kind of issue,
Yep. So when we have some challenges in terms of how well our foot can flex, so meaning kind of, you can point your foot and make it longer, and then you can kind of flex and pull those toes up towards your knee. When we have difficulty kind of moving in both of...
hypermobility.
Yeah. So you have more motion and you need more support and control.
I have a lot of issues. Yes.
So in these cases, Taryn, what I would say is, like you said, what's driving what? So I would recommend getting some updated imaging for your back if we haven't done that in a while, because it does sound like there could be some nerve irritation there. Okay. The other piece is also considering and working on some foot and ankle strength so that we can kind of restore and get as much range of motion and strength for those feet so you can push off well. Because if we can't push off well from the feet, then the back is going to be next in line, and we start pushing off from our spine while we try to do our day-to-day activities. So we want to really try to improve how your foot and your ankle are loading down at the ground and propelling you, and working on that strength. Another piece with some of my patients who do have some more serious arthritis or whatnot that limits how much their feet and their ankles can move is looking into a type of shoe called a rocker bottom. And that rocker bottom helps with that motion. And I still say strengthening is still an important piece of this, but at least to be able to take some of that load off so that your back isn't the only piece that you're kind of pushing off from because of that limited kind of arthritic changes down at the foot and the ankle. So those would be two things that I would start to kind of explore to be able to help with some of those symptoms while you figure out what's going on. Okay? Okay. All right. Thanks so much.
Do you know much about the... Can I ask one more question?
Go for it.
Do you know much about the transmitters that they use, like in the back that they, install in the back for pain, where supposed to help for pain?
So I am familiar. There's
put a wire in the cord.
Yeah, there's quite a few kind of different pieces, and that's not exactly my area of expertise. But yes, they do have kind of some devices that can be inserted at the spine. Sometimes they are creating kind of electric, stimulation to kind of decrease pain. Sometimes they're actually a medicine pump that's like releasing, pain medication and things. There's quite a few different types that can be used. But again, I always go, what's driving the back pain? So back to the very first question that you asked me.
Okay.
Wanting to get to the root of that, because that's going to be the best way to figure out what type of treatment is actually going to get you the outcome that you want. And if you've already done pain injections at your spine in the past and it hasn't been helpful, I go, what's driving your pain is probably somewhere else.
Okay, so check my hip and my feet.
Yes, 100%.
Okay.
Cool.
Okay, thanks.
You're welcome. Thanks for calling, Taryn. Great questions, everybody. And diving into our topics for today, I'm going to go ahead and answer one email that I received over the weekend. This is from Marissa. And Marissa said, I'm so glad that I found the podcast. I have a similar knee story. So last episode, we talked about knees. If you didn't catch that episode, feel free to catch it. And she said, I specifically noticed that I cannot stand up from a squatting position without holding on to something. Previously, I had no problems with this, and I'm a very active 60-year-old person. She said, my doctor said that they could send me to my orthopedic doctor for injections. She says, I would rather see a PT. Do I have to undergo imaging before I see a physical therapist? So Marissa, the good news is you can have any physician who's seeing you write a referral for you to see a physical therapist. If there's a concern that we have a fracture or something more serious going on that we need to rule out before sending you to physical therapy, then your doctor may recommend getting imaging. But imaging is not an automatic requirement before you can go to PT necessarily. So you need a referral to see a PT from your doctor in order for insurance and all of the things to work the way that they need to. So you can ask your primary care, that's I'm assuming who you were referring to when you said my doctor, to be able to help with that. You could also still see an orthopedic doc. You never have to agree to injections or anything right there in the office. You can hear what their recommendations are, ask them for their feedback on your case, and you can still ask them directly for the PT referral and go through that first if you'd like before deciding if injections or other interventions are necessary. So great question, Marissa. Ask your primary care for a referral for PT so that you can go through that and work on strengthening and feeling stronger getting out of a squat. All right. So we're going to go ahead and go to our break here for the first part of the show. Friendly reminder, today's episode is all about low back pain, but you can still call in and ask about other parts of your body, but especially low back questions if you have them. Our phone number is 1-800-375-2872. And when we come back, I'm going to continue my story about low back pain and unpacking the 3 common myths that I find many of my patients keep running into when they've been trying to solve their back pain before they come to see me. And how that often prevents a lot of people from actually getting to the root cause of their low back pain. So we'll unpack that when we come back from the break. As a doctor of physical therapy, I'm all about optimizing health and wellness. We start to lose collagen, the most abundant protein in our bodies, when we're in our 20s. And that really ramps up after 40. Native Path collagen can help replenish this essential protein needed for healthy bones, joints, skin, hair, nails, and digestion. Native Path is packed with the types of collagen your body needs most. With just 2 scoops a day, you'll get 18 grams of protein. It's completely flavorless and easy to mix into any drink. There are no fillers or additives, and Native Path is a third-party tested for purity. Get to getnativepath.com/drpt for a special bundle deal at a fraction of the retail price, plus free shipping. That's getnativepath.com/drpt. Feel better, look younger, and start your transformation today. I do not need a miracle in a bottle, just a product that actually delivers on its claims. And that's why I'm excited about Vibrian's Super C Serum. Super C Serum is designed to replace all the things people my age and older start adding to their daily routines, like day creams, eye creams, night creams, neck creams, wrinkle creams, and the dark spot reducers. It's created with the highest quality vitamin C on the market, plus hyaluronic acid, vitamin B5, vitamin E, and other trademark ingredients. It's gentle enough for sensitive skin, but guaranteed to deliver noticeable results, or they'll give you a refund within the first year. Simplify your skincare routine with Vibriance Super C Serum. Go to Vibriance.com/DrPT to save up to 37% off. Plus, get free shipping. That's VIBRIANCE.com/DRPT. Vibriance.com/DRPT to save up to 37% off and get free shipping today.
This is Dr. PT Christine Paton. To participate, call 1-800-375-2872 or email askme@drptpodcast.com.
Welcome back to the Dr. PT podcast. We are discussing low back pain today. So if you have questions about those common aches and pains that are popping up in your body, especially your low back, today is your day. Give me a call here at 1-800-375-2872. Our phone lines are open and my team is waiting to be able to accept your calls to get you here on the show so I can answer those questions in real time. And if you are on the live stream and you would prefer to send in your question via the chat box, feel free to drop it there too, and my team will make sure that I get it. So we are picking up where we left off here after the break and talking about now the 3 common myths that I find many individuals run into when they are trying to navigate low back pain and trying to overcome it, but keep getting stuck. So the first myth here is my first one, which is rest and stretching will fix it. Okay. Now, rest temporarily, sure, is probably a good idea. Doing some gentle stretching might be a good idea a little bit in the beginning. But rest and stretch on repeat does not increase our muscle strength and does not increase our body's capacity for doing life. And if rest and stretch could fix low back pain, then we would have solved this a long time ago. So a big piece that I find that many of my patients are missing around myth number 1 is that they rest, they do some stretching, they try to go back to the activity that brought on their symptoms, and then it makes it painful again, and then they rinse and repeat. That's not actually solving the problem. We're just kind of stuck in this loop. All right. So if you've done the rest and you've done the stretching, good news is we have more that can help solve your back pain. And you need an updated toolbox because that is not going to give you the long-term result of no more back pain and more capacity for life. All right. Number 2. Myth number 2 is imaging explains everything. Imaging is helpful in certain cases, especially for people that are having ongoing back pain, especially if it's worsening, especially if things are continuing to escalate in terms of symptoms, radiating and traveling down the leg. These can be more serious conditions, and we want to make sure that we start to check on things and get updated imaging so that we know what is the next appropriate step. However, imaging is just one piece of the story. It does not tell everything. And that's actually a good thing. So we have quite a bit of research in terms of MRI reports regarding low back pain and saying that the severity of someone's spinal condition does not automatically correlate with their pain perception. So said another way, severe symptoms on an MRI do not always mean severe pain symptoms for the person. And the opposite can actually be true. Some more mild to moderate cases can have mild to moderate symptoms, or they can have more significant ones. So what does this mean? This means that the brain interprets pain and symptoms differently for each person. But imaging is still important at times. If things aren't getting better, we want to make sure we're not missing something more serious going on. but remembering that imaging is just one snapshot in time, and it's also your body not in motion. So how your body feels in motion versus how it feels in a stationary position are two different things. So I always help my patients to know that if we're going in for imaging, it's highly likely that we're going to find something if we've had a number of birthdays. Okay? But what you find on image does not always correlate to the symptoms that you're feeling. So we use it as a piece, but do not let your MRI dictate everything. You are more than just your imaging, and we need to be looking at how the rest of the body is moving with relation to, in this case, your low back. And the other really good news is that any type of spine condition, and the most common ones here that we're kind of talking about are the regular, everyday low back pain that then eventually can progress, if it doesn't improve, into more serious things like a herniated disc. It can also turn into degenerative disc disease and arthritis. These are the more common diagnoses that a lot of people are navigating. Now, the research shows in all of these cases that movement and exercise is the best intervention for improving low back pain. We also need to acknowledge, and we're unpacking that further in this episode, that where you're having pain in your back is usually not just a pain issue. And that's going to take me into myth number 3, that back pain is just a back issue. Nope. Hardly at all. Nearly every single one of my patients that has come in to see me for low back pain has also had a hip issue or a foot or ankle issue or both. So if I'm just treating their back or they're just doing interventions that are addressing their back, but we're not addressing their hip and their ankle that is not working well, so every single time they walk, run, squat, they don't have good support underneath their spine, their back is going to have to do more work and it's going to get overloaded. So if we're missing those pieces downstream, your back pain is going to stay around until we help the body to move differently. So pain at the back, yes, we need to look there. We need to help that low back be able to have what it needs. Sometimes it's helping it to move better. Yes, everyone usually needs a little bit more core strengthening in their weekly routine, but that alone does not address everything else down below. So if you have been just treating your back and your back pain isn't getting better, good news. We need to look elsewhere. We need to look at the hip. We need to look down at the foot, right? And build that into your treatment plan so that your whole body can move better and so that your back can then have the rest of its teammates working well with it. So the key takeaway here, right? Your low back works on a bigger team with your lower half of your body. They all need to move well for your back to feel well. That's often the missing piece. People are just treating their back pain at the source, but that doesn't mean that it's the root cause. And for the vast majority of people that are navigating low back pain, the root cause of their low back pain is not usually at their back. It's usually somewhere nearby. So that's where you gotta direct your treatment. That's where we have to direct our strength and our range of motion and our mobility work so that everything can move well as a team. Okay? So from here, and unpacking those 3 myths, let's recap. So number 1, that rest and stretching are going to fix your low back pain. Nah, save your time, okay? Short term, very, very acute, that's fine. Do a little bit of rest, take it easy, and then we need to shift gears and help your body to start to move better so you can move more often and have more capacity. That's the long-term plan, okay? Myth number 2, that imaging tells the whole story. Your MRI is a piece of the puzzle, but it does not tell everything. And what shows up on an MRI may or may not actually tell us what's going on through the rest of the system. If you just get an MRI for your back, we don't know what's going on down below, meaning your hip, your knee, your ankle, all of those things. Okay, so it's one piece of the puzzle, but not the whole thing. And then number 3, right? back pain is just a back problem? Nope. Back pain often involves pain at the back, but that's the message that your brain is letting you know that something else needs to move better. And that something else is what we need to go and find and figure out. So in the last segment of the show here, I'm going to go over a few self-assessments for you to figure out, is your hip contributing to your low back pain, or is your foot or ankle contributing to your back pain, or maybe both, depending on the situation, so that you can start exploring those areas and working on range of motion and mobility and strength in those places to help your low back pain get better. Okay? So I'm going to pause with our educational story here, and I'll pick it back up in the last segment. I'm going to answer a few emails that I received. And if you are catching us here live on the show, I encourage you to give me a call here at 1-800-375-2872, or you can drop your questions down in the chat box and our team will get those questions to me as well. And then friendly reminder, you can always send me an email at askme@drptpodcast.com. So I'm going to switch over here to a question I received recently. And this is from Elizabeth. And Elizabeth said, I'm so happy that I found the show and have been listening to you for a while. Thank you for your dedication and bringing the show alive. I'm almost 43 years old. Happy almost birthday next month. I have been suffering with pelvic floor issues, low back pain, and getting back into fitness since having my last baby 6 years ago. She says that my belly fat is so obvious that I look like I'm 6 months pregnant. I had 2 C-sections 3 years apart. I've tried pelvic floor PT, hired a personal trainer to work on my core, and revised my nutrition, but I've had very minimal improvement. However, I feel stronger overall and have gained more muscle, which I am very happy about, and continue to work out 3 to 5 times a week. I'm now considering a tummy tuck surgery with a stomach muscle repair. I have a consult in March. What is your opinion on this procedure? Will it help with my pelvic floor issues and lower back pain? What questions should I ask the doctor regarding my conditions above? Thank you so much for this question. So a couple of things that come to mind, and this is for this particular case, but just surgery in general. Okay? Surgery is helpful in certain situations to help restore the integrity of certain structures. So let's say that if we, need to address an issue at the joint, like we have torn a meniscus, or we have an issue in the labrum, either the hip or the shoulder, or we tear an ACL and we need to reattach these structures, okay? Surgery is often important. But surgery does not address how the body is moving. It is not restoring muscle strength or coordination with the other teammates that area of the body needs to work with. That has to come through movement and rehab and re-education there. So in this particular case, we want to be thoughtful that when we do a tummy tuck surgery, and if we are expecting that the surgery alone will solve low back pain and pelvic floor symptoms and things, I want to encourage people to be hesitant on that. That's a really big jump, okay? Surgery is helpful for restoring certain structures, but then we need to have a thoughtful rehab team that's going to pick up where that surgery leaves off to restore range of motion, coordination, and strength of all of these areas. And a tummy tuck surgery is another major abdominal surgery. And in Elizabeth's case, she's already had 2 C-sections, which is 2 major abdominal surgeries, and then potentially a third one here with a tummy tuck surgery. So we want to be thoughtful. That's a lot of surgery that the body has already gone through. And so the more surgeries we have in these areas, it can sometimes have the propensity to increase more low back pain and pelvic floor symptoms, especially if we do not have a strong rehab team guiding us after the fact. So the other piece here, what questions should I be asking the doctor regarding my conditions? So if you haven't already, I would ask your doctor directly about these same questions and see, what is a successful outcome look like to your doctor, and does that match what a successful outcome looks like for you? Have that conversation. Ask them about what they think in relation to, have you seen this tummy tuck surgery help solve pelvic floor issues? Have you seen it solve low back pain issues? I will tell you right now, a tummy tuck surgery alone does not fix those things. Movement rehabilitation is what is going to help fix those things. The other big piece that I would encourage you to ask this doctor is, do they believe that movement rehab after the surgery is important? I can't tell you how many times I've met patients after they have done a tummy tuck surgery and were told by their surgeon that rehab wasn't necessary. I strongly disagree. Usually when we undergo a significant abdominal surgery, you're going to have a number of weeks where you're not allowed to lift or move your body in certain ways with added load. Right? Usually there are significant lifting restrictions. That means that your body has to lose a significant amount of strength in those weeks while you are following the post-operative guidelines. That doesn't magically restore itself. We need a movement rehab provider to be able to guide and help restore that. So if your surgeon doesn't think that rehab is important, that's a big red flag to me. And I would I would encourage you to ask that surgeon why they don't think rehab is important, and possibly consider finding a different surgeon who does believe that rehab is important, because that's a more thoughtful provider. Right? So with any surgery, ask those questions. Ask your doctor, what do they think a successful outcome looks like for this surgery? And does that match yours? Do they believe in rehab after surgery? Every significant major surgery like this deserves rehab. And if they don't think that's important, find a different surgeon. Those are my big recommendations on this. All right? So thank you for these questions. And then I'm going to jump back into one more email here. This is from Jenny. Jenny said, "Hello, a little bit of background that I think will be helpful based on what you've been talking about on your show. I've had 5 back surgeries, 2 spinal fusions at S1 to L5 and L4 and L5. I have permanent nerve damage down my right leg into my foot. So I live in constant pain every day, and I've done a ton of epidural shots for my back with no relief. I have also had bladder and pelvic floor issues for 20 plus years. I have been on at least 5 different medications for overactive bladder, and they don't help. My new urologist thinks that I would benefit greatly from bladder Botox. I'm 47 years old, and I am literally wearing a Depends because I have zero control of my bladder when I need to go. When I get the signal, I must go. There is no holding it for me. Thoughts?" So Jenny, I'm so sorry. This is a really challenging situation. And my assumption here is that the overactive bladder and the inability to hold your bladder when you get the signal to go is what we would call a neurogenic bladder condition. And this develops when we have injury and damage to the lumbar and sacral nerves, which based on the description that you're mentioning here, I'm suspicious that there's some involvement there. And so when we have a neurogenic bladder, that means that the signaling from the brain to the bladder and the pelvic floor gets interrupted, and this is what makes it difficult to be able to maintain continence. So in that case, if overactive bladder medications have not been working for you, then yes, the next usual recommendation are Botox injections to help with that, with the bladder. So what your urologist is recommending is what we see in the research and things as a possible next step. The other piece, too, that you could also ask them is about percutaneous tibial nerve stimulation. Okay, that's kind of a mouthful. So we call it PTNS. And this is something that could also possibly be explored that helps to stimulate the tibial nerve, and that's down at the ankle. And that tibial nerve shares cross-communication up to the sacral nerves at the pelvis, and sacral nerves share communication to the bladder. So this is kind of a relay system that is used to help to stimulate these pieces to help with reducing overactive bladder kind of signaling and to improve that communication that has been disrupted with the other nerve damage at the lumbar spine and sometimes the sacrum. So I would ask your urologist to also discuss percutaneous tibial nerve stimulation, as well as, like you're being recommended, the Botox, and have a conversation about the two and what they think would be a helpful option for you so that you can then make the next choice about what you want to do. All right. Thank you for those questions. All right, we need to take a break briefly here and transition to our break. But when we come back, I will go ahead and dive back into our story about what are some of the self-assessments that you can do to figure out with your low back pain what's going on in terms of, do you need to work on some things at your hip? Do you need to work on some things down at your ankle, or possibly both, to help your low back pain get better? So again, give us a call here at 1-800-375-2872. I'll catch you in a few minutes. I do not need a miracle in a bottle, just a product that actually delivers on its claims. And that's why I'm excited about Vibriant's Super C Serum. Super C Serum is designed to replace all the things people my age and older start adding to their daily routines, like day creams, eye creams, night creams, neck creams, wrinkle creams, and the dark spot reducers. It's created with the highest quality vitamin C on the market, plus hyaluronic acid, vitamin B5, vitamin E, and other trademark ingredients. It's gentle enough for sensitive skin, but guaranteed to deliver noticeable results, or they'll give you a refund within the first year. Simplify your skincare routine with Vibriant's Super C Serum. Go to Vibriance.com/DrPT to save up to 37% off, plus get free shipping. That's VIBRIANCE.com/DRPT. Vibriance.com/DRPT to save up to 37% off and get free shipping today. As a doctor of physical therapy, I'm all about optimizing health and wellness. We start to lose collagen, the most abundant protein in our bodies, when we're in our 20s. And that really ramps up after 40. Native Path Collagen can help replenish this essential protein needed for healthy bones, joints, skin, hair, nails, and digestion. Native Path is packed with the types of collagen your body needs most. With just 2 scoops a day, you'll get 18 grams of protein. It's completely flavorless and easy to mix into any drink. There are no fillers or additives, and Native Path is a third-party tested for purity. Get to getnativepath.com/DrPT for a special bundle deal at a fraction of the retail price, plus free shipping. That's getnativepath.com/DRPT. Feel better, look younger, and start your transformation today.
This is Dr. PT Christine Paton. To participate, call 1-800-375-2872 or email askme@drptpodcast.com.
Back to the Dr. PT podcast. I'm your host, Dr. Christine Paton, and today we are talking all things low back pain. So if you have questions about this, feel free to give us a call at 1-800-375-2872. We've got a caller here on the line. Hi, David. Thanks so much for calling. What's your question today?
Oh, right. Yes. Well, I had the lower back pain actually in 2009, and they told me I had to have an operation, but my football buddies that I played college football said, don't get an operation because you got to get one every 6 months. So I've been waiting since then to find out if...
Hey, David, can you hold your phone a little closer to you because you keep going in and out?
Yeah, what's a bad connection over here?
Oh, perfect. You're good right there.
My football buddies...
Oh, David, it's breaking up again.
You have to get one every 6 months. So I want to know if a CT is good as an MRI.
So, David, let me recap since the call went in and out. So what I'm hearing is you're having low back pain. You're asking if, did a doctor recommend injections? I heard something of like, I would need to go back every 6 months. Recap for me here.
Okay. I've taken many of those shots in the back.
Mm-hmm.
I don't want to have an operation because my football buddies say that you got to get one every 6 months. So I've been waiting since 2009 to find out what the best operation techniques are today.
David, what's your diagnosis?
I have spinal stenosis.
Okay.
lower sacrum, in the sacrum.
Mm-hmm.
3, 4, 5.
Yeah.
And is a CT scan just as good as an MRI? Because I've had so many MRIs and I'm claustrophobic, can't take it.
Mm-hmm. I hear you. So which scan is better? From my understanding, the MRI is going to give you a better, clearer picture for something when we're measuring stenosis. Sometimes people will use a CT because if they have other metal in their body from other injuries or things like that, they may not be able to go through an MRI machine. So that's where a CT can sometimes be used. But what I would say is with stenosis, if it's a more severe stenotic case, then this is where we may need to discuss a more serious surgical intervention with your doctor. But my other question then, David, is what are your symptoms and what have you tried so far besides the injections? Have we done any physical therapy? Have we worked on strengthening around your hips and further down with our core and down the chain of the leg? What part of that has occurred in your treatment plan so far?
Well, I do leg extensions, leg curls. I used to do hypers, but I don't have that apparatus anymore.
Okay.
I'm overweight. I've been coaching a little bit, and just lately I've lost strength in my legs. I can only walk for a couple of minutes, and then the pain is so bad in the hips. Is that because of the back?
It often can be related to that, and kind of the compression there within the spine. So what I would say is for, consulting with your orthopedic surgeon and your spine doctor about this and discussing those pieces, because weakness down the legs also is another sign that we need to be thoughtful about the intervention sooner versus later so that doesn't become a permanent, injury to the nerves. And then that creates other issues in terms of your muscle strength and overcoming this. And then back to the question or the piece that you were saying that your football buddies say, hey, every 6 months you got to go back for injections. So when someone has surgery for their back like this, the recurrence of pain is high because a lot of times people need to go to physical therapy and do more rehabilitation than they are told. And rebuilding strength around your spine and your core and your hips are going to be essential so that you don't have to keep having injections. So step number 1 I would recommend is having an updated consult with your spine doc to say, hey, what's going on in terms of my case right now, and getting the appropriate imaging that you need. And if you feel like it's too hard to get an MRI because of the claustrophobia, then I would also talk to your doctor about that, because other medications can be given to you to help with that claustrophobia so that you can get the imaging that your medical team needs to give you the best recommendation for what needs to happen next. And then after that, knowing that the best long-term plan is going to need to involve some physical therapy and some strengthening through that lower half of your body to help support your spine, because that's what we need happening too.
Okay, 2 questions for you real quick. Are the operations a lot better now than they were in 2009? Could I trust the technology today compared to 2009?
So that's a great question.
Operations?
A lot of things have improved, but again, this also depends on where you live and access to the different medical facilities and all those kinds of things. So again, these would be important questions to ask your surgeon. How often do they do this procedure? What are their outcomes? What do they typically see in terms of, success rates and stuff? And does that line up with what you're hoping for in terms of a successful outcome also? And having those more educated discussions with them too.
Okay, and also I had one, they took it and they said that one of them had fused already. Is that a good thing when it's fused by itself?
I'm not able to directly answer that question well because I don't know what level it is and all of those kinds of things. But basically, we want to have movement at every level of the spine. That's what allows our spine to be able to move well. If something has self-fused, then that limits movement there, and that can also impact nerves and things at that level, and where that level then translates down the leg. So again, these are all important questions for you to be asking your potential surgeon about what they're recommending for those outcomes. Okay.
Would flexibility or yoga help? Stretching, getting into stretching more, would that help the back as well, and the legs and the hips?
So long-term stretching is not going to be the long-term plan. You need strength to be able to support the body. Okay, and we want to be thoughtful
Gotcha.
if we have stenosis, that some people can overstretch, and that can actually make their stenosis worse. So we want to be thoughtful about how we're moving, and having medical providers on your team, a PT and your surgeon, to be able to best guide you for your particular body and your case. All right?
Mm-hmm.
Perfect.
Well, thank you very much. You're really, really good, and Dr. Laura loves you.
Thank you, David. Appreciate you calling.
Okay.
Hope you feel better
listen
soon.
to my son. He's Grammy nominated. David Electric. Look him up. San Clemente's a song.
Cool. Thank you.
Grammy nominated. David
Have a great
Electric.
one.
Bye.
All right. So to recap here and diving into our last two assessments. So we've been talking about, why is low back pain so common, right? We've got we're either moving too much at our back and not moving enough through other parts of our body. We might not have enough strength for our whole body for the level and volume of activity that we want to be doing. And then also, is our mindset around our low back pain possibly interrupting our progress? So being afraid to move and pulling back from things that cause our low back pain without addressing what is causing that in the first place. So second section, we talked about kind of the different myths and things that can kind of get in the way. So rest and stretching, David just learned, and we also talked about this in the second half of the show, that rest and stretching alone are not going to help you overcome your back pain for the long term. We need strength. We also need to be addressing how your back, your hips, and your foot and ankle are moving or not moving. Number two, we also talked about why we want to be thoughtful of our imaging. And if we're getting an MRI, that your imaging tells one piece of the picture, but it doesn't tell the whole story. It's not telling us how our body is moving and other areas that we need to improve movement for, so that your low back pain can feel better. And then also number three, we talked about, addressing and thinking about that back pain is not just a back problem, right? So where you're having symptoms is not often the root cause. So in order to best help our back where we're having symptoms, we need to figure out what's driving it. And usually this is something further down the chain, right? Which is what we're going to dive into here. So one big piece that I find with nearly every single patient of mine that comes in with low back pain is this issue, their hip flexor. Your hip flexor is a really important muscle, and most people have a lot of tightness in their hip flexor. And when they feel tightness there, they stretch it, okay? That's fine. You can give it a little bit of a stretch, give it some temporary relief, but that does not help it to get stronger or to build more capacity. We need to strengthen our hip flexors if they're feeling often really tight, because we need them for a lot of things. Another big piece that often blows my patients' minds about their hip flexor is that it is not just right at your hip crease. Your hip flexor is a really long muscle. It actually attaches on the front of your spine, starting at L1, which is right where your rib cage ends and your lower spine begins. It's that high up. And it's attaching at L1 through L5. It crosses through the front of the pelvis and then crosses to the top of your thigh bone. It is huge. So that portion that's attaching to your spine is an important stabilizer of your spine. So if it's really tight, that's not going to help your low back to feel very good. We need to strengthen and work on range of motion there and capacity through your hip flexor so that your back can move better. So how do you know if your hip flexor is tight? Well, some of you automatically out of the gate are going to know that because you often feel tension and tightness there. So that's already a sign that that needs to get worked on. Number two, if you're not really sure, here's a quick self-test. So in standing, bring your feet together, okay? And then I want you to take one foot and you're going to put your foot back, all right? The width of your 2 feet should be about the stride that you would take while you're walking, right? With that leg behind you, I want you to notice, did your spine have to overarch in order for your leg to get back, or were you able to keep your torso nice and quiet while you extended that leg behind you? Ideally, our spine should not have to overly extend for us to get our leg behind us. If it does, then that shows us that our back is having to work a lot harder to push your body forward when you're walking, running, doing life, and that our hip flexor is too tight, and that is what is making it hard for you to extend your leg with your leg muscles, and instead your brain goes, all right, we still need to get that leg behind us, so I'm going to use the back because that's the next best, easiest thing, right? Check this on both sides because a lot of times people might have some asymmetries. If one side is a lot tighter than the other, then that's also going to create some different walking and movement patterns that can start to overload one side of your back in particular, or overload a hip, or overload a knee or an ankle. So this can start to travel down the chain. So get curious when you're walking and moving. Are you able to take an equal stride on both sides, or is one side a lot shorter than the other? Note that usually the shorter stride side, if that's true for you, often doesn't feel that uncomfortable, but the side that's moving more is usually going to be the side where you have low back pain or hip pain or different things, because now that side is having to move a lot more for you than the other more limited side. So check your hip flexors. And if you need some exercises to work on for strengthening those, I also have some hip flexor circuits on my YouTube channel that you can check out to help you work on those as well. So stop just stretching your hip flexors and start helping to strengthen them, and your back will thank you, right? The next self-assessment, moving down the chain to your foot, all right? Your ankle is a really important joint for the whole body, and also where we do a lot of push off when we're walking and running, but also our ankle needs to bend well in order for us to bend down. If it can't bend well, then your ankle stops short, and the next thing that has to start moving more is usually up the chain at your hip and your low back. So I can't tell you how many times I've had patients come in for low back pain thinking that they have a back problem, and what we find is that they actually have an ankle problem. They've got a really stiff ankle that doesn't move well, and they have a calf that also is really tight and not moving well, and their foot and ankle is jammed up, and they can't move well and push off that foot, so they start to push off more from the other side, or both feet and ankles are really limited, and so the brain goes, well, I still need to move forward in life, so the next easiest place to start to push off from is to overarch their back to move forward. So we need to be looking at the foot and the ankle and your calf and making sure that that's all moving well. So here's a quick self-assessment if you're not sure. If you already know that you have a lot of tightness and tension there, go work on that, all right? And not just with stretching. Again, you can do some calf stretches, but then we need to strengthen it. Strengthening those muscles is what is going to help your muscles to maintain more length long-term. Stretching just gives them a temporary change, but not a long-term one. We have to have strengthening in the mix for your brain to download that new length to use in your daily activities. So here's how you can test your ankle. So find a wall. You're going to go close to the wall and use a tape measure, or a very easy way is to take kind of the width of your hand, right? Where the wall and the floor meet, place your tape measure there. You should have back yourself up about 4 inches, or use the width of your hand. And your toes should go right there in front, so they're 4 inches away from the edge of the wall. Okay? Your body is then going to come down into what I call the proposal position, that half kneeling position. And the foot that you have 4 inches away from the wall, I want you to now glide that knee forward. Can you touch the wall without your heel lifting up? We want to be able to have about 4 inches where your knee can glide over your foot well, for your foot and your ankle to move well. If we don't have that, or we have a lot less, then that's a big sign that you want to work on that, because that's going to limit how much your back and your hip can move well. The other piece, notice side to side. A lot of people will have a significant asymmetry on one side compared to the other. So we want to improve both sides so they have similar range of motion, because if we have that asymmetry, then that's going to overload one side of your back a lot more with every single step that you take. So to recap, we want strong hip flexors and we want strong calf muscles to be able to squat and lunge well, because if those areas are really tight, they also limit how well you can hinge and bend down in a squat or a lunge. But they also are going to affect how well your back can move when you're walking, running, doing life. So your back is not just, or back pain is not just a back problem. It's usually a full body problem, and we need to figure out where you need to work and move better. All right? So I hope that today's episode helped to point out why low back pain is so common, why stretching and rest are not the solution, but strengthening the whole chain is, and also to help you get curious about some areas that you might want to go work on to move better and to build more strength within in your hips and your ankles to help your whole body, and especially your low back, to feel better. Right? So thank you so much for joining me today. We are going to be continuing to unpack other areas of the body in future episodes, so stay tuned for that. Thank you so much for everyone who called in today and asked your questions. I hope that all of the listeners here also got to learn a little bit more about their body. So I encourage you to send me an email if you have any questions that percolate after you listen to these episodes at ask me at drptpodcast.com. And I look forward to catching you all next week, always on Mondays at 2 p.m. Pacific, 5 p.m. Eastern. Keep moving well and moving often. Take care, everyone.